Does your mother or father need help in their home and you're wondering if they qualify for home health care and whether or not Medicare will pay for it? Do you know what services are provided by Medicare and how your parents go about getting those services? Watch this video to the end to get the answers to those questions and more. By subscribing to my channel and hitting that little bell, you'll be notified every Monday when I post a new video designed to help you navigate the sometimes difficult healthcare system. Hi, I'm Dr. Snow, and over the years I've helped many patients and my own parents navigate the Medicare system. Did you know that Medicare will pay for home health services in addition to the more common hospital, doctor, and medication needs? These services may include intermittent nursing care, home therapy care, or care from a home health aide. Intermittent skilled nursing is defined as a predictable, recurring need for skilled nursing less than 7 days a week or less than 8 hours per day. These services could include IV medication therapy for a set period of time, tube feedings, catheter replacement, dressing changes for a wound, or therapy by a licensed physical therapist or speech therapist for a limited period of time. Occupational therapy does not qualify a person for in-home care by itself. However, if other qualifications are met, occupational therapy can also be provided. If you qualify for skilled services, you may also qualify for an in-home aide that can provide services such as bathing, toileting, and dressing. Need for personal services alone do not qualify you for in-home care. The qualifications for these in-home services include 5 parts. The first qualification is that you must be homebound. Homebound means that you cannot, or it would be extremely difficult physically for you to leave your home, and you could not do so without assistance. If this video is giving you value, please give it a thumbs up. The second qualification is the need for intermittent skilled services. The third qualification is that you must have seen your physician within 90 days before the services start, or within the first 30 days after the services start. This physician's visit can be in his office, in the hospital, or in some circumstances via teleconferencing. Fourth, your physician needs to fill out and sign a document called a home health certification that states that you are homebound and you need intermittent skilled care. This document also must state that he has seen you within the required time and that he has authorized a plan of care for the services that you require. If you need services for more than 60 days, your physician will have to review and recertify you for the extended period, but he does not need to see you face-to-face to recertify you. The fifth and final qualifications for Medicare to pay for these services is that they must be provided by a Medicare certified home health agency or an HHA. I will leave a link in the description below that will help you find a certified HHA in your area. Services that are not covered by Medicare include 24-hour in-home care. If your parent needs 24-hour care, they will either need to hire a private nurse or enter a skilled nursing facility. This service does not cover prescription medications except for IV medications or medications that cannot be self-administered and must be administered by a nurse. Home health services do not include meals delivered to the home, and while a home health aide may do some light housework, laundry, and prepare some meals, if this is the only thing that the person needs, they will not qualify for the services. If a person is diagnosed with a terminal illness, homemaker services may be available through hospice. I have written an ebook that helps parents and children address subjects that may be difficult to bring up but are necessary to plan for the future. You will find the link to get this free resource in the description below. I am sure it will help start the conversations that are so important. If this video has helped you understand Medicare home health services, please give it a thumbs up and consider subscribing to my channel. Has your mother or father ever received in-home services paid for by Medicare? Were you pleased with the services and the outcome? Did you find the process of obtaining these services for your parents easy or difficult? Leave your comments below on your experiences with home health services. I hope this video helps you understand what services are paid for by Medicare and what qualifications must be met before they pay. Thank you for joining me today. Stay healthy and have a blessed week.